Hey guys, so today we're going to look at the important structures and need to know structures and the pathologies of the spine and the thorax here. So the first things we're going to look at is one, relating to the skull. We have a big hole in the bottom of the skull for our spinal cord to come down through. That big hole is called the magnum, foramen magnum. Magnum meaning big, like a big caliber of gun. So the foramen magnum is the big hole in the bottom of the skull. So everybody's got a hole in their head, right? Big hole in the bottom of the skull where the spinal cord comes down and then passes through those vertebral foramens all the way down throughout the entire length of the spine. The other important structure to look at is the intervertebral foramen. Like we said, the intervertebral foramen is formed by those two superior and inferior facets coming together and making that little hole, and that's where the spinal nerves exit from the spinal cord and column off to the side. So we can see here on DEX that we have the spinal nerves coming through. Another key thing to note is the vertebral artery. So if we zoom in here on DEX, we can see that there's this red line that runs through the transverse foramen only of the cervical vertebrae, as we saw in an earlier video. The other things to note are the curvatures of the spine. So if we look at Dexter from the side here, like we said in the previous video, we have an anterior curvature in the neck, a posterior curvature in the rib cage, an anterior curvature in the low back or lumbar region, and then a posterior curvature in the sacrum and the coccyx here. So we said that the anterior curvatures of the neck are lordotic curves. So we have a lordotic curve here in the cervical region of the neck and the lumbar region of the neck. Then we have kyphotic curves in the thoracic region of the spine and the sacral region of the spine as well. Another important structure to note too was that intervertebral disc. As we saw in the lecture on joints, the intervertebral disc is this little disc that composes of two components. It has an outer ring to it of fibrocartilage. We have the outer ring and it's called the annular fibrosus. Then we have a pulpy, liquidy, gel-like center to it called the nucleus pulposus. So the outer ring is fibrocartilage called the annular fibrosus. The inner, it's almost like a jelly donut, the inner gel of it is called the nucleus pulposus. And so it kind of looks like a jelly donut, and we'll see that again when we talk about the pathologies here. So the next thing we're going to look at is some ligaments to the spine. Now I know we didn't really pay much attention to many ligaments in a lot of the joints, but when we're talking about the spine, we're going to see a few here. So the first ligament is what we call the supraspinous ligament. The supraspinous ligament. Well, this supraspinous ligament, supra meaning superior, spinous, like the spinous process, this ligament runs along the tips of the spine, which then comes up to about C7 right here. And then it continues on and actually connects to the back of the head just like this. And so you can see there's this space in between the neck and this, where this ligament would be. So we have here an extension of a ligament that runs out and comes to that tendril, that tendon there, called, and right here, so we have the ligamentum nuchae. We saw this in the shoulder and arm lecture, that's where the trapezius touches. The ligamentum nuchae is that big ligament that stems from the spinous process of the cervical vertebrae here out to the tendon, the tendril of the supraspinous ligament there. So the ligamentum nuchae. So then we had ligaments in between each spinous process. So you can see there's a little gap in between each spinous process, and we call that the interspinous ligament. Inter meaning in between, spinous, in between the spinous processes, and it's a ligament. The other two ligaments we're going to look at are the longitudinal ligaments. Longitudinal meaning long. So the longitudinal ligaments run on the bodies of the vertebrae. One you can't really see on my model here, but the anterior longitudinal ligament runs along the front of the bodies of the vertebrae all the way up the very top all the way up through the entire spinal column here. Now the posterior longitudinal ligament runs along the back of the bodies, and we can't see that because it's actually inside of the spinal column, inside the vertebral column. So those are the four major ligaments we're looking at in relation to the spine. We had the supraspinous ligament, which runs along the tips of the spinous process all the way up to about the neck, where it merges and becomes the ligamentum nuchae. We then had the ligament in between the spinous processes called the interspinous ligament. Then we had the longitudinal ligaments, one anterior and one posterior. The anterior runs along the front of the vertebrae all the way up the entire length of the spinal column. And then the posterior longitudinal ligament runs along the back of the vertebrae, or bodies of the vertebrae, all the way up through the entire spinal column, but it's inside the actual vertebral column. So let's go ahead and look at the pathologies here. So the first one we're going to look at is scoliosis. So scoliosis, some of you may be familiar with, is what we call a lateral curvature to the spine. So instead of the spine running roughly straight up and down like this, it curves off to the side. So it might actually run like this, kind of like a little serpentine belt along the side. So you would have to see it if you're looking at someone from the front or from the back. And it's a lateral to the side curvature of the spine. And can massage help? Well, it depends on what caused it. If it's muscularly related, we would be beneficial and helpful in the process of recovery and rehabilitation alongside physical therapy and other corrective means for that. But if this was something someone was born with, we don't actually want to get rid of that. It's probably there serving a useful purpose or a functional compensation pattern that we just don't want to mess with. And so in all cases, we'd just like to facilitate this compensation pattern and just help manage pain or any discomfort that might be associated with this condition. So aside from scoliosis, the next condition we're going to look at is kyphosis, which is, now everybody has, as we saw, a kyphotic curvature of the spine. But kyphosis is a condition where that kyphotic curvature is excessive. We call that hyperkyphosis, which is that hunchback position. So you see like those little ladies with their hunchback position, their hyperkyphosis. Again, look at what's happening, right? So my shoulders might come forward and my back might arch up and I have this little forward head posture and everything. So if these muscles were tight and that's what contributed to the kyphosis, massage might be beneficial in helping to relieve these muscles and bring them back and into a more upright posture. But again, the same thing with the scoliosis. If this just happens because it's your body structure and you naturally have it, again, we don't want to bring you out of patterns that are natural and needed for your body. We would just want to facilitate the pattern and just help manage any pain or discomfort with the condition. So on the flip side of kyphosis, we're going to look at lordosis. So again, we all know we have lordotic curves in the low back, the lumbar region. Well, again, this is an exaggeration. So I call this the booty pop syndrome. So this is where your butt might stick out. So your hips anteriorly tilt. So that means that my hips point forward. They're going to point downward, if you can see here, if you can see the lower part. So it kind of creates that little booty pop. And we call this saddleback or swayback. Saddleback because you could just like jump on them and just ride them down the road like they're a horse, like they have a saddle, right? So again, same things here. Could be caused by tight hip flexors and other muscles that attach to the hips themselves and pull it down. Could be weak abdominal muscles, could be over tight low back muscles pulling the hips up. Basically anything that's going to shift those hips this way. So here's the front of my hips, here's the back of my hips. Any muscles above my hips that pull it up like this are going to shift it down, and any muscles on the front of my hips are going to pull it down like this. So it's causing this, what we call anterior tilt of my pelvis, which will shift it into that position. Again, if this is caused by, muscular related issues or just, improper use of the body, we could help, we could be beneficial. But again, if it's serving a useful purpose, don't mess with it. Now, the next condition we're going to look at is what we call spondylolisthesis. Spondylolisthesis. Sponder is a word referring to the spine. So anytime you see spond or spondyle, then we're referring to the spine in some way. So spondylolisthesis, what exactly is that? Well, this is a pretty severe condition where the bodies of the vertebrae shift forward, and the bodies of the vertebrae actually touch. So they kind of shift forward and the anterior parts of the bodies of the vertebrae touch, and they shouldn't be doing that, obviously. Again, this is a pretty severe condition, and massage would be of little benefit in a curative measure, but maybe in a palliative way it would be. The next condition we're going to look at is spondylosis. Now this is a general condition. Spondylosis is usually what we call arthritis of the vertebral joints here, more commonly of those facet joints, those zygapophyseal joints. And most commonly, it occurs in the cervical region of the spine. So this is just general wear and tear and arthritis of those vertebrae, of those joints in those vertebrae. Again, massage could be beneficial in pain management, but nothing on the curative side. Relative to spondylosis, we could have spondylitis, which is inflammation of those similar joints, but usually on the opposite end of the spine, usually in the larger joints of the spine, usually around the lumbar vertebrae. Again, not much massage can do except for being palliative in this treatment. The next condition we'll look at is what we call spinal stenosis. Spinal stenosis. Well, let's look at spinal, obviously referring to the spine, but what is stenosis? Stenosis means a narrowing of a passageway or a canal. So spinal stenosis is a narrowing, usually because of inflammation, of the vertebral column, which then closes and actually starts to compress on the spine and then causes a lot of referred pain. Not much massage can do except for being more on the palliative side of things, and very limited at that even. So spinal stenosis is a narrowing of the spinal canal causing compression on the spinal cord. The next condition we're going to look at is what we call ankylosing spondylitis. So again, dealing with the spine here. This condition is more common in men, usually in between their 20s and 30s. And what happens here? Ankylosing spondylitis. This is an inflammatory disorder of the spine which causes the anterior bodies, usually in the low back and lumbar area, to fuse together, which then creates immobility in this area here and another slew of problems. Again, not much massage can do except for being palliative in this measure. And most people live a pretty healthy and normal life dealing with this condition. The next condition we're looking at is costochondritis. So costo, ribs, chondr, referring to the costal cartilage, itis, inflammation. So costochondritis is inflammation usually at the costochondral joints here. So inflammation in this area usually could be an excessive overuse injury or onset, but it could have an idiopathic onset as well. So massage could be palliative, and in some degrees it could be marginally better or helpful. But otherwise, massage could just be palliative in the grand scheme of it. So a fun fact though of costochondritis. We hear this chondritis, chondral, right? And we've heard this before in layman's terms. We call people chondriacs. So a chondriac is actually what we perceive to be someone as making up symptoms and kind of imagining problems in their body. But it stems from something that in medicine happened a while ago, where patients would come in and complain about pain, usually right here in this lower part of the ribs. We call this the hypochondriac region. And so usually it might be, could have been costochondritis or other things in that nature that could cause pain. And so pain, and without any marked symptoms, without any signs, visual signs or measurable signs, doctors are like, well, your pain I can't explain, so you must be just making it up more than likely. So we call them hypochondriacs, and we just thought they were making up these symptoms and making up this pain. But they were experiencing pain in what we call the hypochondriac region. And that's where we got those hypochondriacs out there in that layman's term or layman's version of it. So the next condition we're looking at is that herniated discs, and some people call it a slipped disc, which is really a misnomer. Discs don't slip. They don't slide out of place, and they don't slide and slip on a banana peel. What happens is, if we remember back just a moment ago to the structures of the disc, and we said it's like a jelly donut, where we have that hard donut outer shell and then that soft, gooey jelly center. Well, this is exactly what happens. If you were to take that donut and squish it, well, the jelly would squirt out on one end. Same thing here. So usually compression or a weakening in the fibrocartilage ring of the intervertebral discs causes the gel-like center of it to protrude outwards. So you can actually see it right here on Dexter. There's a little bit of a red mark right here onto the side of this disc, which would be a herniated disc or a slip disc. Now, slip discs don't always cause pain. They can, especially if they start to compress on nerves, and they can usually heal on their own, usually with or without surgery, and massage serves very limited benefit outside of being palliative. Now, the one thing about the massage is we don't want to really have any movement or flexion on the spine, just because we don't know exactly where that herniation might be, and we don't want to move the spine in a way that it's going to compress and squish on that herniation and cause pain or even further complicate the problem. So usually be very careful with moving their spine. And some really good techniques would be traction. So oftentimes a really good method of dealing with a herniated disc is that inversion table and allowing the spine to elongate, and that traction, that release of the column, or release of the pressure from that downward pressure to come in. So traction is usually pretty good, but be very careful when you're flexing or laterally flexing or extending the spine as well. Our next condition is called spina bifida, which is usually a birth defect where the spine develops incomplete and the spinal cord develops outside the actual spinal column. And it can be operated on and be surgically repaired, but it usually can have effects on the body later on. It usually could lead to paralysis of the lower legs and other things like that. Nothing massage could do, nothing we need to worry about, but hey, knowledge is good. The next condition we're looking at is called radiculopathy. Now, it sounds like a ridiculous name, but a lot of people mention this, and they usually mention it in a wrong way. Someone says, oh, I pinched a nerve in my neck. Well, probably not. You probably just tweaked a muscle and it's tight and spasming on you and causing pain, and you probably didn't actually pinch a nerve. Because when it comes to pinching a nerve, there's a few types. We can have a soft tissue impingement, which is, yes, related to a muscle spasm, or a hard tissue impingement, which is related to compression from bone to bone contact. The bone is crushing or impinging the nerve itself. So radiculopathy is basically a pinched nerve. So the nerve gets pinched anywhere along its path and then sends pain and referred sensations distal outwards. So you might have radiculopathy, you might have an impingement here, maybe in the maybe around at the start of the spine, maybe at the straight at the root, or it could be impinged here at the brachial plexus where the pec minor runs through and impinges the nerve, and then it sends pain out to maybe the tips of the fingers and anywhere else in the arm, and that is what we call radiculopathy. And of course, a massage therapist may be helpful and beneficial, especially if it's a soft tissue impingement. We can definitely be palliative, and we might be curative if it's soft tissue related, but obviously we can't do anything with displaced bones and that hard compression or hard impingement of the nerve. Another condition we're going to look at is called an inguinal hernia. An inguinal hernia usually occurs right here at the lower parts of the abdomen. So the inguinal region is what I like to call the ingroinal region, because it's essentially in the region of the groin. So essentially right here. Now, an inguinal hernia is where parts of the large intestine actually will protrude the walls of the stomach and maybe even the muscles and have a bulging bump on the outside. So a hernia is where one part of a structure pushes through and bulges through another structure, usually because of weakening, or this is pretty common with like power lifters, bodybuilders, people lifting heavy weights. They might cause a hernia and have it rupture and have it push through, have parts of their body push through other parts. So aside from the inguinal hernia here in the groin region, we could have a hiatal hernia, which a hiatus is like if you're going through a hiatus, you're going through something. If you're going on a hiatus, you're going on somewhere or through something. So the diaphragm we saw sits here in the base of the ribs, right? And we know that there's blood vessels and tubes that need to run through that diaphragm. So a hiatus is where those tubes go through. So we have esophageal hiatus and so on and so forth for any of those tubes in the area. So the hiatal hernia is a hernia that occurs in the diaphragm, usually from the stomach. The part of the stomach, part of the gaster, pushes up into the diaphragm, pushes up past the diaphragm through a weakening and can cause pain. With both of these hernias, massage is very beneficial. Maybe palliative at nature, but best to just avoid the area in itself. The next condition we'll look at is a pretty innocent condition, and we've probably all experienced it. We call it a stitch in the ribs. That pain in the side, usually from overexertion, running too fast, or doing too much at one time, and we get that pain in the side, the side hurt there. Massage is definitely beneficial in this case. It's usually pretty non-invasive, and there's usually no complications associated with this. Usually it's just minor inconvenience, minor pain from exertion. So the next condition we're looking at is what we call pseudo-angina. Pseudo is a Latin word that means fake or false. Angina is a word that means chest pain. So pseudo-angina is false chest pain. So usually this is pain felt right here, and most people believe it to be, or even lower, believe it to be a heart attack. It has nothing to do with the heart. This usually occurs with people with healthy coronary arteries, and it usually comes from other complications like heartburn or other structures in the area that might act up and become inflamed, and it just happens to be near the heart, and we associate it to be heart pain, but it has nothing to do itself with the actual heart. So massage has very little benefit in this, and won't do anything. Even palliative, I'm sure, wouldn't really matter too much. The next condition we're going to look at is thoracic outlet syndrome, which is a group of disorders we've characterized that it comes from impingement of nerves or blood vessels coming from the thoracic region here. So usually coming from the brachial or cervical plexus, or coming from arteries that run underneath the clavicle here, usually the subclavian arteries or anything like that. So this is usually an impingement condition, and it's usually associated with overuse. Usually people who work like this a lot, especially massage therapists, cause a lot of pressure and compression here in this area, which then compress blood vessels or nerves or anything in this area, and then have referred sensations and other complications. Massage for thoracic outlet syndrome can be very beneficial depending on the onset. Like we said, this is a group of disorders, and so it's very broad and hard to really decipher and pinpoint in any one direction. But that's the basic premise, is that it's an impingement related complication that leads to pain and paresthesia to the distal ends of the body. So, well, that's going to do it for the pathologies and the need to know structures of the body. So go ahead and study up, and I'll see you next time. Have a great day.